My name's Allison McLean, and I'm a physiotherapist, and I'm the owner of Peak Performance Physiotherapy and Massage Therapy here in Whistler, British Columbia. We have 6 physiotherapists, 5 registered massage therapists, and we have 4 people that run the front desk and keep us all under control. Depending on the time of year, we see a lot of skiing, snowboarding related injuries. In the summertime, it's really busy with mountain bike injuries because the Whistler Blackcomb Mountain Bike Park is pretty popular. We've got a lot of baseball injuries, and now road biking is becoming very popular, so there's injuries related to that. It's a very, very busy community. Lots of athletes, lots of professional athletes. I needed ultrasound in my practice because I think that it's a really useful tool. It's an hour-long treatment where we assess your spine with the same way we would any other assessment. We watch your range of motion, we watch your movement patterns, figure out if you're in pain, if not, what's your neurological status, if there's any nerve impingements. We'll start the ultrasound assessment by looking at the abdominal wall, the bladder, and see what's going on with that, and then put you over on your stomach and check the posterior muscles, and then whatever we find from there will direct what we do. So then we start on the biofeedback portion, so we see what we need to work on, and then start working on that muscle, getting that person to engage it, to learn how to maybe not overfire one group of muscles and let the stabilizers kick in a little bit better. Make sure both sides are equal, so we do a right to left comparison all the time. Most spinal injuries, if you don't correctly get the proper muscle control back in the core, you're looking at a repeated sort of chronic situation, or you can be looking at that. So it's kind of nice to nip it in the bud, when you have someone who's just had an injury, to get them to regain control of their core musculature, their spinal musculature, and also for people who have had chronic pain for a long time. It's a new field for physio, and it's just really, really beneficial for the type of patients that we see. It's cutting edge technology really in Canada and North America now, and the applications are growing. Like I said, right now we're looking at a protocol for the lumbopelvic region, right? And so we're building on that and looking now at more, going into the cervical spine and the thoracic spine. So we'll build protocols to see the muscle firing patterns of all the neck muscles and what the diameters and dimensions should be in normals, and then look at it from that perspective. So it's going to grow from just looking at the lumbar spine and pelvis to the rest of the spine, which I think is exciting. I have one patient who is a hockey player, was professional in his younger years and now isn't, but still plays 3 times a week up here, so he's quite a great athlete. And he really didn't understand why his mid-thoracic spine was constantly being irritated